today our topic is report writing. Being a psychologist or a counseling psychologist or professional psychologist, we would like to know a extensive report writing skill. See, report writing, why we require report writing? Because we are going to handle various psychological issues in the society, and we are going to be part of in the research activity. We are the persons who is going to contribute various aspects of social issues, psychological issues and psychocultural aspect. Yes, in this point of time, being a psychologist, what is the skill we supposed to require and how to obtain it? Today's our topic is report writing skills and the procedures. See, the report is a statement of results of an investigation or if any matter on which defined information is required. See, it is considered to be a major component of research studies because as a researcher remains incomplete. Without a report, the communication, that planning, method and matter of regarding direct test. See, this disclose unknown information. See, for example, a person wants to do a research, he required certain procedure, certain method, certain hypothesis, certain objectives, and based on the objectives you should use some certain techniques or testing, and based on the testing we get some results, and the results we try to discuss about what are the findings it is, and the research is ongoing process. Like that, we are a psychologist, we need to have various report writing skills and various types of reports like laboratory report, technical report, report of work placements and industrial visit reports and trip field reports and field work report and research evidence report and case study reports, like various types of reports are available. But the reports which is important to the especially psychology background, see, these are the format which we need to follow the report writing. See, if we take an example of research report writing or research project submission or research titling, how to do it? You see, the format of report writing is, first one is the title, acknowledgement, abstract, introduction, review of literature, material required, method which we are using, and based on the method we are going to do the results and discuss the what is the results which we obtain and conclusions and recommendations, practical applications of the which we concluded, and what is the reference which been referred from the results and evaluations and appendixes. See, these are the complete which we are a research based report writing. See, what is mean by title? See, that title should not be paragraphs. The title supposed to be concising of what is our objective. See, for example, if I take an example of it, my research theory is anthropos. See, my top title is I was choosing a title anthropos. What is mean by anthropos? Male menopause. I want to study the men's anthropos levels. What I done? See, to study anthropos and various psychological aspect, or I can study anthropos, normal controls and andro people, like simple form we have to concise the whole objective of your title. One. Next is acknowledgement. Where did I acknowledge this information? That's supposed to be written in that. Next, abstract. The abstract is the concise of your report, the complete your introduction or review of literature, your methodology, or your results and procedures, and what is the test tools you use for, what are the results you findings you got it, and the results are suggestive of which is the previous findings are supporting your documents, and conclusions. A abstract is the complete your research study report is concised one. Okay. Then introduction. The introduction you have to write the importance of your research and what are the nomenclatures and variables which you are going to take into your research, and you describe about various variables and you describe about the prevalence and incidence of your object, and you have to give the importance of your research. And another important step is review of literature. So, review of literature minimum you should take 10 years from the date of your research start time, 10 years. For example, this is a 2024, you have to start collecting information, relevant information related to your variables from 2014. From 2014 to 2024, what are the results taken place in your variable and what are the findings they gone, and how what way it is your research study and previous research studies differs one another. That has to come in the review of literature. Once you use review of literature, and you have to go for the research methodology. In the research methodology, aim, objectives, hypothesis, and the tools which you are using, and what is the tools and description about the tools, and how you are going to use the tools, and how the procedure of the tools, and once you got the procedure of the tools, and what are the results you obtain from the tools, and what is the results which is going to accept the previous studies and reject the previous studies, and you have to conclude this. This is the method we are going to see it. Results which we obtain our own findings, and the results we are going to collaborate with the hypothesis and see the discussions whether our hypothesis is accepted or rejected, and as for the rules. And finally, what is your study concluded, and what is your further recommendations from your study, and further studies you are need to be recommendations, and what is your study given results, and how much is practically applicable for the public. And also you should give references, which are the references you refer for the review of literature, you refer for the introduction, you refer for the hypothesis acceptance, and you have to see what are the testimonial you used in the appendix. This is the complete report writing in the format of report writing for the research report writing. Then go ahead. This is the American Psychological Association guidelines. As for American Psychological Association guidelines, we have to follow any research submission or research report writing. So you have to be written the abstract. So what is the written abstract in the first title? See, is a condensed format. It should be ordered. It is a single paragraph. You have to condensed. That is called as a writing a abstract in our report. Writing in the introduction. So the introduction supposed to be the importance and prevalence and incidence of your objectives and your variables. The introduction to be the topic of background and hypothesis, and what is you are going to predict from your study, and describe the past research literature. See that the review of literature. See, relevant review of literature you have to get it from the various sources, like you have journals, international journals, national journals, or book reviews, and you have to work with the various collecting literature sources. From there, and relevant literature has to be keep in the order in a APA format, and you should see the reliability, validity of your study, and you should see that what is the reliability, validity, what is the material you are using for your test, and you should be particular about, and you should be any research has to be carried forward. The first is the informed consent supposed to be taken. After informed consent, you have to administer the psychological tools, and from their tools you have to collect the information, you have to do the research analysis. From there you have to do discussion and interpretation and conclusion and practical applicability of your research findings. These are the APA guidelines of report writing. Yeah, see, we know that various research based report writing. What is a psychologist report? Maybe if you go to a medical professionals, a medical professional also does a report writing. A biochemist does the report writing. Person who does investigation does that report writing. But what way we differ? Psychologist report, what way it differs? So psychological report is a very extensive and very formative and descriptive. The psychological report depends on your psychological assessment, and that's the reason the psychological assessment is similar to psychological testing, but usually involves more comprehensive assessment for the individual. Psychological assessment is a process that involves the integration of information from multiple sources, such as from the test, normal, abnormal, personality, intellectual abilities, and interest, attitudes, and we try to understand various information from the personal interview. Also we collect the information, and the complete the person's information, test information, interest information, family resources information, or previous record information, collaterally information we call it is a personal information, and we take all this information, club together and frame a psychological report. In the psychological report, and there is a very crucial information is psychological history. The first, when you want to do a psychological reporting, you should follow the certain steps of psychological case history details. First, you have to take identifying of information. First, you should be identify the person's a preliminary information, name, age, marital status, gender, occupation, the religion, rationality, and what is the various applicable income, and whether the socioeconomic status is background, everything you have to collect from the informant, from the client. The same information, and who is taking information from the client, the same informant information. The informant is who is the caretaker of the patient, who is the caretaker of the client, and who come along with the client. It has to take in all the identifying information, both has to be simultaneously written in the written form. And why did they come? Reason for referral. Why did they come? Who referred to you? Whether they come voluntarily or the client was referred by some other expert, whether they referred by the pediatrician or psychiatrist or neurologist or family physician, who referred is very important, the reason for the referral. And cheap complaints, the cheap complaints, what is the complaints given by the patient, what are the complaints given by the informant, and you have to write the complaints as for the verbatim of the patient and the informant. Once you collect the information and the cheap complaints and the duration of the complaints, then if you fulfill that information, then you have to go for the history of present illness. What is the history of present illness? What are the cheap complaints you obtain from the client? The same information should be written in the developmental manner, in the systematic manner, all the symptoms, and what is the reasons for the symptoms, what is the precipitator factor for the symptom, and what is the things he is expecting. From the symptom existence to till is coming to your cabin, you have to collect the story. Once they completed, you have to collect the past psychiatric and medical history of the client and family history. In the family history, we can just go with the genogram. We can just simplify the genogram is very easy to understand the complete family history. And personal history. The personal history is supposed to be start from the prenatal development, postnatal development, early childhood, childhood and development, schooling, occupation, menarche and habits. All these things comes under the personal history. Is also very important, collecting information. Once the history, psychological history is not just questioning and collecting information. The patient entered into your room, from this how is opening his door, how is sitting, how is talking, what is his speech and communication, everything should be very carefully observed. That is what the behavioral observation and mental status examination is very crucial, especially in psychological history taking. And you should be very careful to understanding and observing of the client, appearance of the client, and how the client is oriented about your communication, whether he is oriented about your reciprocal things, how is his behavior, how is his dressing, how is his attitude towards you, and how whether he is cooperating to you, to talking to you, whether he is attentive to you or not, or is very guarded, or is a general description like is how is he sitting it, his clothes, whether he is groomed or not, whether he is looking healthy or not, whether he is looking sick or is looking like a very old or very vague look, and his nails are properly cut, and whether nail biting is there, whether he is anxious, whether he sit in the corner of the chair. See, everything you have to observe the client. It is not particularly you are asking whether you are sitting or no. See, you should observe, that is very important. And also you should simultaneously you should observe what is his speech. Is it rapid, slow, sluggard, or whispered, or echolalia type of speech is there or not. And you should also have, and you should question and confirm both sides. One is questioning and confirm, another one is your expertized observation also. Both should be coordinate and understanding the mood and effect. So, mood is a pervasive, sustained emotional that colors the person's perception of the world. How does the patient say he or she feels? Is it depressed, anxious, angry, irritable, euphoric, empty, guilt, or anhedonia? What type of mood he has or she has? You should be reciprocally confirmed or observably confirmed. And what is affect? This affect is the outward expressions of the patient. How is experiencing about it? whether it is restricted or blurred or flattered effect. So, what type of emotional expressions is appearing in front of you, that is your expertise observation. You should see that the client how it is. This is all mental status examination, and thinking and perception is a very crucial point in the mental status examination. Form of thinking, overburdens of ideas, flight of ideas, slowness of thinking, stream of thought, quantification of the patient. See, you have to see that how the patient is talking to you, whether his speech is loosening of association, whether it is a casual or whether it is a very point to point, or it is restricted, whether a coherent speech or incoherent speech, whether he is using any new words which is not traceable in the dictionary. What type of thinking pattern is just quantifying in front of you, and whether his content of thinking, whether he has any preoccupation of his illness, whether he is obsessed about his illness, is possessed about his illness, and is very compulsive, very like twisting hands, washing hands, touching things, and anything in the fear about it, whether it is content of suicidal ideations, or whether he is having any antisocial urges or any impulses are there. You have to be carefully observing and questioning and confirming of the client and informant. And you can also see there are a lot of thought disturbances like delusions. What is meant by delusions? It's unshakable false belief. A person has, without any evidence, he has any false beliefs, such type of false beliefs, and he is try to frame it. So, there is a systemized delusions and systemized delusions. The delusions also be very quantified with the confirmation with the informant. See, that is like ideas of reference. Yes, people are looking at me, means that they looking at me means they are going to kill me, they are going to harm me. This any persecuted delusions are there. Keep remembering, sometimes the persecuted delusions can be applied and towards the therapist also. That is what is very important. And formal thought disorders, they like circumstantiality. See, when you ask a question, what is your name? The person is giving name. He just try to bring lot of unnecessary information. My father name, my grandfather name, my village name, my district name, and my name is very familiar. See, he is coming to the point, but in between he is giving lot of unnecessary details. That is the circumstantiality. Clinch association. The thoughts are associated by the sounds of words rather than their meanings. See, he just rhyme is see, he gives rhyme of the voice, but he won't give you any sort of it. See, that's of the cleanse of association, derailment, synonymous of loosening of association, breakdown of the both logical connection between the ideas and overwhelmed thoughts, sense of goal directions. You don't have any ending point. You just jumping into one another, and you just disconnecting it, and this is not able to give you words, and there is no sense of it. See, flight of ideas. You get lot of overload ideas, thoughts, and which is not connecting, and very rapid and very pressure of speech, and just keep on going it. See, this another thought disorder is like nihilism. So, giving is a idiosyncratic ways of words which you don't feel any meaning in the words. Such type of, they use words. Perseveration, repetitively using of the words and phrase and ideas, can say the, this is the perseveration. Tangentiality, see, the response of the question, the patient give you reply to the is a appropriate to the general topic without actual answering of the question. See, they try to generalize each and every aspect rather than the giving straight point answers. See, thought blocking, sometimes is just try to talk, and in between is just stop talking and break down of the flow of ideas and thoughts. Such type of thought blocking can happen. Thought insertion, thought blocking, thought broadcasting. People says that, see, my thoughts are taken by some popular hero and talking into the TV channel, like the such type of thought broadcasting can also be seen. Some powers are entered in my brain, that's the reason. Such type of thoughts can also comes under the category of thought disorder. See, these are the various thought disorders. You have to be very careful when you are talking with the client. And also perceptual disturbance can seen. Illusion, see, there is a object, but there is object, you are misinterpreting of the object, considered to be illusions. What is meant by hallucinations? False perceptual interpretation. See, without an object, you are perceiving an object, and you see that, see, without any sensation, you are getting a sensation, that considered to be hallucinations. Depersonalization, derealization, extreme feelings of detachment from the self or from the environment. See, you have detaching from, see, you are not there in the situation, you are also able to say what happened, and you are going to say what is going to happen. Such type of precognition, Depersonalization, derealization can also see in perceptual disturbances. That's also be part of in the psychological history. And in the cognitive functions, the sensorium, cognitive alertness, how the person's observation about the surroundings, and what is his orientation, what is his name, where is he, whom is talking, and where is the location it is. Just casually just ask him and we try to have orientation. That could be the adequate concentration, starting counting from 100 minus 5 or otherwise counting from 20 to 1 or 40 to no reversal, that can be counted as concentration. And memory, immediate memory, recent memory, and long term memory. So you have to question in appropriate manner. There are simple techniques or simple examples are there. It is easy to understand whether that is primary memory is intact or not. Simple general information, calculations for the general aspect is capital cities. Give me your country, how many states are there, state capitals, abstract reasoning, and try to understand insight and judgment. The insight and judgment is very powerful to understanding of psychological aspects. See the level of insight. See there are 6 levels which we need to quantify from the client. How we need to quantify that? The based on the interaction with the client, we need to quantify the whether the level of insight is the what level it is. See if he completely denial he has illness or not. He is completely denial of his illness is considered to be level 1 insight. Level 2 is the sight awareness of being sick and need help, but denying to take the treatment. Such things are level 2. Level 3, the awareness of his being sick, but blaming others because his sick is not his, because of his parents, or why did he come to the hospital? Say my wife brought me here, or my mother brought me here, I don't have any problem, though they just they consider that I am having problem. Such type of blaming others is the level 3. Level 4, awareness of the illness is caused by something unknown in patient. That is the awareness is there, but they are not understanding the cause is themselves is the unknown. See there is a 5th level is intellectually insight. The people know that they have illness, they have symptoms considered to be illness, they need to take a medication, but they are still experiencing acquiring knowledge to confirm the illness. And the true emotional insight is 6th level. The person understands the illness and he try to understand what is the treatment procedure and try to approach the appropriate person and take treatment. That is the insight level 6. And judgment, there are 3 types of the 3 kinds of judgment is there. I did not put another type: social judgment, test judgment, and individual judgment. Social judgment, see we see that, for example, if you are walking on the road and there is a sealed envelope address cover on the road, what will you do? If a right judgment person, the person can take that envelope cover and put it in the postal box, and or otherwise the address known people are there, they can hand over to that. This is appropriate. See a person is socially inept, not why should I bother, I do not want to do, take it, it is just throw it out. This is not a socially acceptable judgment. Okay. Test judgment, it is like the patient predicts of what he or she would do in the imaginary situation. If something happened in that home, and that is the thing which happens to be. See this is the various in the report writing, we need to go through the, after taking a detailed case history from the identification data to the insight level. Once you have a complete history, let put all the symptoms or information into the diagnosis model. See we have DSM and ICD models. I just put only DSM. See diagnostic statistical manual, axis 1, 2, 3, 4, 5, axis 1, axis 2, axis 1 clinical syndromes, all schizophrenia, generalized anxiety disorder, mood disorder, all adjustmental disorder, neurotic disorder, everything comes under the axis 1. All the symptoms which criteria is meeting, according to the criteria you have to put axis 1. If it is a personality disorder, put in the axis 2. Is any medical condition based psychological problem, axis 3. Is psychosocial environmental problems, axis 4. If you have a global assessment functioning low, that can be considered the axis number 5. See once you finalize, if you look into the differential diagnosis, what is appropriate diagnosis? 5 differential diagnosis, look nearby diagnosis is very important. And what is the prognosis of the condition? Opinion about the course of illness, and what is the outcome of the illness, what is education qualification of the client, and how is understanding of this condition, and what way we can helpful to him to bring back to the normal. See the progress is good, his education is good, understandability is good, his willingness is good, and he is taking medication or psychological therapies, it is good prognosis. If is a poor education, not poor understandability, not able to take medication or psychological therapies, is the poor prognosis is a very important factors. What are the modalities of treatment is there? This is the biopsychosocial models. Biopsychosocial models, predisposing factors. See, before existence of the problem, what are these condition, family life or financial condition, his background is a very important is treatment model. Precipitated factors, what are the factors as responsible for him? So, peer group influence is the responsible for his having alcoholic dependence, or peer family disturbance is the responsible for having a pathological conditions of the condition of a person, or what is the thing is very important. Perpetuating factors are there, what are the other factors, education, location or willingness and his attitude, what are the things which is responsible to improve him. Biopsychosocial model is the best model to treat the various conditions. The comprehensive treatment plan according to the client and condition based evidence based therapies. According to evidence based therapies, we have to think about short term plan and long term goals, and it includes pharmacological therapies, psychotherapies, hospitalization, psychosocial skills and training. Some people, some patients require inpatient treatment, some people require outpatient treatment. Those who are severe conditions, those who are required supervised treatment require inpatient, those who can take treatment and go ahead in the things. These are the various report rating. The overall report rating is the basis on the, first you have to frame the complete sheet after collecting case history, after administering psychological assessment, after collaborating of statistical diagnostic statistical manual or ICD-10 International Classification of Diseases, you have to frame a small report. See, the report consists of identification of data, a brief history of presenting complaints, a past history of the client, family history and personal history, mental status examination, cognitive functions and general information, judgment, insight. These are the crucial points need to be in the report writing. Next, you have to summarize. In the summary, you have to keep all the things in order, and in this summary, you have to find what are the diagnostic criteria is meeting or she is meeting, and based on the diagnostic guidelines, you have to see which condition he is or she is, and in the diagnosis, we have to go ahead the differential diagnosis, then you go for the therapeutic intervention. These are the report writing method which we need to be very focused. Yes, this is what the psychometric report. Psychometric report is a very crucial or a very comprehensive report. Okay, thank you.